This ebook is brought to you by Egenvard 1998. Related research. The scientific status of Freud's theory is one of the more hotly contested and disputed question in all Freudian theory. Was it science or mere armchair speculation? Did Freud propose testable hypotheses? Are his ideas experimentally verifiable, testable, or falsifiable? Karl Popper, the philosopher of science who proposed the criterion of falsifiability, contrasted Freud's theory with Einstein's and concluded that the former was not falsifiable and therefore not science. It would be fair to say that for much of the 20th century, most academic psychologists dismissed Freudian ideas as fanciful speculations that may have contained insights into human nature but was not science. During the last 5 to 10 years, the scientific status of Freudian theory has begun to change. At least among certain circles of cognitive psychologists and neuroscientists. Neuroscience is currently experiencing an explosive growth through its investigations of brain activity during a variety of cognitive and emotional tasks. Much of this growth has been due to brain imaging technology afforded by functional magnetic resonance imaging, MRI, that maps regions of the brain that are active during particular tasks. At about the same time, certain groups of cognitive psychologists began doing research on the importance of non-conscious processing of information and memory, or what they called implicit cognition. John Bargh, one of the leaders in the field of social cognitive psychology, reviewed the literature on the automaticity of being and concluded that roughly 95% of our behaviors are unconsciously determined. This conclusion is completely consistent with Freud's metaphor that consciousness is merely the tip of the iceberg. By the late 1990s, the findings from neuroscience and cognitive psychology began to converge on many cognitive and affective processes that were very consistent with basic Freudian theory. These commonalities have become the foundation for a movement started by some cognitive psychologists, neuroscientists, and psychiatrists who are convinced that Freud's theory is one of the more compelling integrative theories, one that could explain many of these findings. In 1999, a group of scientists began a society called Neuropsychoanalysis and a scientific journal by the same name. For the first time, some eminent cognitive and neuroscience psychologists such as Nobel laureate for physiology, Eric Kandel, along with Joseph Ledoux, Antonio Damasio, Daniel Shatter, and Vilayanur Ramachandran, were publicly declaring the value of Freud's theory and contending that psychoanalysis is still the most coherent and intellectually satisfying view of the mind. Neuroscientist Antonio Damasio wrote, "I believe we can say that Freud's insights on the nature of consciousness are consonant with the most advanced contemporary neuroscience views." 20 years ago, such pronouncements from neuroscientists would have been nearly unthinkable. Mark Soames is probably the most active person involved in integrating psychoanalytic theory and neuroscientific research. He argues, for instance, that the following Freudian concepts have support from modern neuroscience: unconscious motivation, repression, the pleasure principle, primitive dreams, and dreams. Similarly, Kanda argued that psychoanalysis and neuroscience together could make useful contributions in these 8 domains: the nature of unconscious mental processes, the nature of psychological causality and psychopathology, early experience and the predisposition to mental illness, the preconscious, the unconscious, and the prefrontal cortex, sexual orientation, psychotherapy and structural changes in the brain, and psychopharmacology as an adjunct to psychoanalysis. Although there are some gaps in the evidence, the overlap between Freud's theory and neuroscience is sufficient to make at least a suggestive, if not compelling, case for their integration. We have reviewed some of the empirical evidence for unconscious mental processing. The ID and the pleasure principle and the ego and the reality principle, repression and defense mechanisms, and dreams. Unconscious mental processing. Many scientists and philosophers have recognized 2 different forms of consciousness. First is the state of not being aware or awake, and second is the state of being aware. The former is referred to as core consciousness, whereas the latter is referred to as extended consciousness. The brainstem, and the ascending activating system in particular, is the part of the brain most directly associated with core consciousness, or unconsciousness in the sense of not being awake. For instance, comas come from damage to this region of the brain stem and render a person unconscious. In contrast, being aware and able to reflect on one's knowledge and self is more a function of activity in the prefrontal cortex, the dorsal frontal cortex. Moreover, a major theme of cognitive psychology over the last 20 years has been the phenomenon of non-conscious mental processing, or what is referred to as implicit, non-conscious, or automatic thought and memory. By this, cognitive psychologists are referring to mental processes that are neither in awareness nor under intentional control, and thereby come close to Freud's definition of unconscious. Of course, Freud's concept of the unconscious was more dynamic, repressive, and inhibiting, but as we see next, cognitive neuroscience is uncovering a similar kind of unconscious. Pleasure and the ID, inhibition and the ego. Findings from many different neuroscientific programs of research have established that the pleasure-seeking drives have their neurological origins in two brain structures, namely the brain stem and the limbic system. Moreover, the neurotransmitter dopamine is most centrally involved in most pleasure-seeking behaviors. In Freud's language, these are the drives and instincts of the ID. In 1923, when Freud modified his view of how the mind works and proposed the structural view of ID, ego, and superego, the ego became a structure that was mostly unconscious, but whose main function was to inhibit drives. If the part of the brain that functions to inhibit impulses and drives is damaged, we should see an increase in the ID-based pleasure-seeking impulses. That is precisely what happens when the frontal limbic system is damaged. Many case studies and more systematic brain imaging research have demonstrated the connection between the frontal limbic system and impulse regulation. The first reported and best-known case of this was the 19th-century railroad worker Phineas Gage. While working on the railroad, an explosion caused a metal rod to shoot upward and through the bottom of his jaw up and out the top of his forehead, damaging his frontal lobes. Amazingly, perhaps because the speed of the rod cauterized brain tissue, Gage never lost consciousness and survived. Physically, except for loss of brain tissue, he was relatively fine, but his personality changed. By all accounts, this rather mild-mannered, responsible, and reliable worker became, in the words of his doctor, irreverent, indulging at times in the grossest profanity, which was not previously his custom, manifesting but little deference for his fellows, impatient of restraint or advice when it conflicts with his desires, at times pertinaciously obstinate, yet capricious and vacillating. In other words, he became hostile, impulsive, and not at all concerned with social norms and appropriateness. In Freudian lingo, his ego no longer could inhibit basic drives and instincts and he became very ID-driven. According to Soanes, the underlying theme in the frontal lobe-injured patients is their inability to stay reality-bound, ego, and their propensity to interpret events much more through wishes, ID, that is, they create the reality they wanted or wished for. All of this, according to Soanes, provides support for Freud's ideas concerning the pleasure principle of the ID and the reality principle of the ego. Repression, inhibition, and defense mechanisms. Another core component of Freud's theory involved the defense mechanisms, especially repression. The unconscious actively, dynamically, keeps ideas, feelings, and unpleasant or threatening impulses out of consciousness. Soames reports cases from the neuropsychological literature demonstrating repression of unpalatable information when damage occurs to the right hemisphere, and if this damaged region becomes artificially stimulated, the repression goes away, that is, awareness returns. Additionally, these patients frequently rationalize away unwelcome facts by fabricating stories. In other words, they employ Freudian wish-fulfilling defense mechanisms. For instance, one patient, when asked about the scar on his head, confabulated a story about its being a result of dental surgery or a coronary bypass, both of which he had had years before. Furthermore, when the doctor asked this patient who he was, the patient would variously respond that he, the doctor, was either a colleague, a drinking partner, or a teammate from college. All of these interpretations were more wish than reality. One study by Howard Chevron and colleagues has recently examined the neurophysiological underpinnings of repression. More specifically, they addressed the question of whether people with repressive personality styles actually require longer periods of stimulation for a brief stimulus to be consciously perceived. Prior research had established that people in general vary from 200 milliseconds to 800 milliseconds in how long a stimulus needs to be present before being consciously perceived. The study by Chevron included 6 clinical participants between the ages of 51 and 70, all of whom years prior had undergone surgical treatment for motoric problems, mainly Parkinsonism. During these surgeries, a procedure had been performed in which electrodes stimulated parts of the motor cortex, and the length of time it took for the stimulus to be consciously perceived was recorded. The results of this procedure showed that these 6 participants also ranged from 200 milliseconds to 800 milliseconds in how long they took to consciously perceive the stimulus. For this, 4 psychological tests were administered at the patient's homes and then scored on their degree of repressive tendencies. These tests were the Rorschach Inkblot test, the Early Memories test, the Vocabulary test of the WAIS, an IQ test, and the Hysteroid Obsessoid questionnaire. The first 3 tests were rated by 3 blind clinical judges on their degree of repression, and the 4th test was scored objectively for its degree of repression. The results showed that the combined ratings from the 3 judges were significantly and positively associated with the time it took for a stimulus to be consciously perceived. Moreover, the objectively scored Hysteroid Obsessoid questionnaire confirmed the result. In other words, the more repressive style people have, the longer it takes them to consciously perceive a stimulus. Neither age nor IQ was related to the length of time it takes for the stimulus to be perceived. As the authors acknowledge, this finding is but a first step in demonstrating how repression might operate to keep things out of conscious awareness, but it is the first study to report the neurophysiological underpinnings of repression. Research on dreams. In the 1950s, when the phenomenon of rapid eye movement, REM, sleep was first discovered and found to be strongly associated with dreaming. Many scientists began to discount Freud's theory of dreams, which was based on the idea that dreams have meaning and are attempts at fulfilling unconscious wishes. Moreover, the REM research showed that only brainstem regions and not higher cortical regions were involved with REM states. If these cortical structures were not involved in REM sleep and yet they were where higher-level thinking took place, then dreams are simply random mental activity and could not have any inherent meaning. From the perspective of this so-called activation synthesis theory, meaning is what the waking mind gives to these more or less random brain activities, but meaning is not inherent in the dream. Solmes's primary research area is dreams and based on current dream research, including his own. He takes issue with each of the assumptions of the activation synthesis theory of dreams. Most importantly, Solmes argued that dreaming and REM are not one and the same. First, in about 5% to 30% of the wakings during REM sleep, patients report no dreams, and during about 5% to 10% of non-REM wakings patients do report dreaming. So there is no one-to-one correspondence between REM and dreaming. Secondly, lesions, due to injury or surgery, to the brainstem do not completely eliminate dreaming, whereas lesions to the forebrain regions, in the frontal lobes and parietal temporal occipital juncture, have eliminated dreaming and yet preserved REM sleep. In action, dreams appear not to be random in content. Recently, Daniel Wegner and colleagues tested one aspect of Freud's theory of dreams. As Freud wrote in Interpretation of Dreams, wishes suppressed during the day assert themselves in dreams. Wegner and colleagues examined whether this was so in a group of more than 300 college students. First, participants were instructed the right before bed, they opened the instructions only directly before going to sleep, to think of 2 people, one whom they had had a crush on, and one whom they were fond of but did not have a crush on. Next, participants were assigned to one of 3 conditions: suppression, expression, and mention. In the suppression condition, students were instructed not to think about a target person, either the crush or the fond of person. For 5 minutes, in the expression condition, different participants were instructed to think about the target person during this 5-minute period, and in the mentioned condition, other participants were instructed to think about anything at all after mentioning, the target person's initials. Moreover, during the 5-minute period when they were either to think or not think about the target person, they wrote a stream of consciousness report and put a check mark on the side of the report every time they thought of the target person. This was a validity check to establish whether the suppression manipulation technique worked. It did. When they awoke the next morning, participants reported whether they dreamed, how much they dreamed, and how much they dreamed of the target and non-target people, self-rated dreaming. Lastly, they wrote a report describing the dream report. The stream of consciousness and dream reports were coded by a rater blind to conditions on frequency of target and non-target appearances. Results showed that students dreamed more about the suppressed targets than non-suppressed ones. They also dreamed more about the suppressed targets than the suppressed non-targets. In other words, students were more likely to dream about people they spend some time thinking about, target, but especially those targets they actively try not to think about, suppression. Suppressed thoughts, the authors concluded, are likely to rebound and appear in dreams. This finding is quite consistent with Freud's theory and not consistent with the activation synthesis theory that REM sleep provides random activation of brain activity that is devoid of meaning. In the words of Wegner, although there remains much to be learned about how dreams are formed, the finding that suppressed thoughts rebound in dreams provides a bridge linking an early insight of psychoanalysis to the discoveries of cognitive neuroscience. However, the current trends in neuropsychoanalytic research neither confirms nor even mention Freud's psychosexual stage theory, especially its more controversial elements of Oedipal conflicts, castration anxiety, and penis envy. Instead, neuropsychoanalytic research has focused on those parts of Freud's theory that appear to be empirically standing the test of time. The neglect of Freud's psychosexual stage theory is somewhat consistent with much post-Freudian and neo-Freudian theorizing that has either downplayed or abandoned this part of Freud's theory. So while many of Freud's major ideas unconscious, pleasure-seeking, repression, ID, ego, and dreams might be garnering neuroscientific support, not all are, and still others are in need of modification. But the out-of-hand dismissal of Freud from a scientific perspective appears to be getting more and more difficult as findings from cognitive psychology and neuroscience accumulate.